So I've been running the stroke program at the Children's Hospital for almost 15 years now. We started back in 2005, 2006, so we've seen the growth of treatment and awareness for childhood stroke. And in recent years, with the advent of hyperacute treatment with recanalization therapies, thrombectomy, thrombolysis in adults, we were interested to know whether or not we had opportunities in children to deliver this care, and if so, what might be the barriers, how could we optimize this kind of care. So with the help of one of my very smart and hardworking young residents, Dr. Melissa Hutchinson, she was also very interested in this, and she worked with me and did all of the hard work of reviewing our stroke registry dating back to 2005. And we evaluated those children who ended up having a final diagnosis of acute arterial ischemic stroke from age 2 really to age 18. And our questions were how many of them might have qualified, and of those that might have qualified for hyperacute treatment, how many of them were able to get it, and what were the reasons why children might not receive it or might not qualify. So we found about 113 cases over that time period who came to our care at CHOP during the acute phase of their stroke, and about a third of them met one of the major criteria, which is to have a significant deficit from an acute stroke. And of the third of those who qualified based on an acute deficit of sufficient severity, we then looked at other qualifying criteria. Those included most notably the time frame. So they would have to be within the possibility of receiving care with thrombolysis within 4.5 hours of time last seen well, and within 6 hours of time last seen well if we use our current treatment protocols for thrombectomy. So of that group, about a third having a qualifying deficit, only about 15%, or about half of them, met other criteria, including age and other medical qualifications. And so we feel that as many as 15% of children might qualify if they reached an appropriate facility, were quickly evaluated, and had access to care. Well, I just want to recognize Dr. Hutchinson for the excellent work she did. One of the great benefits and joys of being in the field of academic medicine is to work with young, talented, energetic people. And she's certainly one of those, as well as all of her peers in her class and in her field. So the field of neurology has hope because we have these talented young people that are working and learning and growing. And I have the great pleasure of being able to be part of her growth and that of her colleagues to advance knowledge, to continue to promote and prod us older folks to think bigger, broader, and move things forward in our field.